Hi everyone, this is Dr. Isabelle Amigues. I'm getting onto Instagram as well. Give me 1 second. And it's going to happen soon, I think. So yes, I'm Dr. Isabelle Amigues and your friendly rheumatologist and host of the Rheumatology 101 Live. And today we're going to talk about the different type of arthritis. It's a question that's coming directly from one of you who have sent me an email. So thank you so much. Yeah, when I can, I absolutely love to answer your questions. So please don't hesitate. Okay. So I'm gonna share a couple of cases because I think it's always nicer to have cases so you know exactly what we're talking about, and then we can discuss the different type of joint pain. So the first one is, what's the difference between someone that has, we're gonna imagine that everyone is 45 years old, okay? What's the difference that a woman, and we're gonna take woman, that could be men, that's 45 years old, that has joint pain, as sorry, let me stop this. So what's the difference between someone that has joint pain that's like 45 years old, right? So you have a 45-year-old woman that has joint pain, and then you're like, okay, you have arthritis. So you have arthralgia or you have arthritis. So arthritis, so arthros means joint, itis means inflammation. Arthralgia is the pain of joint. Okay, so just that we are all talking about the same thing. Now, what's the difference of what are the different type of arthritis? And I have actually shared this a lot, but I'm going to do it differently this time, which is I'm going to present different cases. And in a way, I'm going to pause and I'm going to ask you to think of what this can be. All right. So again, we're always going to think of a 45-year-old woman. So 45-year-old or young woman that has joint pain. So the first thing, so this first one has joint pain that's after she rock climbs. You haven't seen that, it's me, right? After she rock climbs, and it's more if she does more, but she doesn't have pain if she's not using her joint. It's only of a couple of her fingers, and it's at the end. Well, that is there's no morning stiffness, so she's not stiff in the morning. She doesn't have any other issues than this joint pain, and really the only time that it's bothering her is when she rock climbs. Okay, so what do you think that is? So this is most likely osteoarthritis. Why? Because it's a mechanical joint pain. It's at the end of the day. There's no morning stiffness, and it's worse when she uses her joint, right? And she says that it's when she rock climbs. By the way, this is me, and it's only a couple of times. It's when I don't rock climb enough. I put too much pressure on my joint. You can actually see that this joint, which is very common, the third one is very common to have some issues when you rock climb because we put a lot of pressure. It's the longest one, okay? So that's the number one. So osteoarthritis. Osteoarthritis is actually very common. And we don't really have treatment for it, which means that what we try to do is just make sure that it doesn't happen, prevent the joint from being touched. So if you're a rock climber, you want to really use your tendon and help them and use your muscle more than anything else, and not put too much pressure on the joints. So that's number one. And then you can use Tylenol or ibuprofen or like NSAID, so non-steroidal anti-inflammatory drugs such as ibuprofen, Aleve, etc. Okay, and that's osteoarthritis. It's mechanical. There's no inflammation, or at least we don't think that there's a ton of inflammation. All right, now we have the same 45-year-old woman. This time it's not me. And this person comes and she's basically saying, hey, I had an infection. And after this infection, I developed joint pain that's affecting my low back. So I have back pain now. And I also have, I've had a sausage finger. Also, I've had really some pain in my when I urinate. I've had some inflammation of my eyes, and the pain is really painful. And yes, I take some ibuprofen; it helps, but it's not enough. Okay, And when I examine her, she has some inflammation of her joint, and she has some tenderness at the insertion of the ligament and tendon to the bone. Okay. By the way, for whoever is watching live, thank you so much. Put an hashtag live because it's always cool to see that. And if you're watching this on a replay, put a replay, hashtag replay. And right now, what we're doing is that we're doing different cases of different arthritis so that you understand how a rheumatologist think, and also that you understand maybe where you're standing. Okay. So this 45-year-old woman that I'm talking about has so joint pain that's worse in the morning, that's associated with morning stiffness of an hour, and gets better with exercise. So the more, like, she's basically realized that she's exercising more than before because she's trying to feel better. And said, so ibuprofen, Aleve, those things, but it's not enough. Okay. So what you've learned is that this is an inflammatory arthritis, that it affects the back, and it also affects the peripheral joint. So when we think of this, we're like, okay, well, and she also had an infection. Could this be? I'm pausing just in case you want to play with me, right? And if you're a fellow, this is cool. So we are thinking reactive arthritis. The other thing is that sometimes an infection can lead to an autoimmune disorder or rheumatologic disorder. So you also have to think of psoriatic arthritis. So you're going to look for psoriasis. It hides in the ears, in the belly button, the buttock, the nails. So ask if there is nail polish, ask them to remove it. Send you a picture after. Okay, so that's a good one. Now we have the same. So this is what we're going to think. We're going to look at it. We'll do some blood work. We'll do some X-rays. We might do an MRI, and that will give us more information. Okay, but that's inflammatory. Another inflammatory arthritis that can happen, it's usually more like in older. So this time I'm going to take a 60-year-old man. So 60-year-old man that has joint pain that's so it happens in flares. It's going to be like super badly painful. This is the worst pain he's ever had. And then it goes away completely. And then again, he might have another flare, and then it goes away completely. Okay. When you see this, and it's a very inflammatory, very swollen, the touch of a sheet is really painful. When you see this, you have to think of crystal arthropathy. There's two types of crystals that can cause crystal arthropathy. There is calcium, CPPD, calcium deposit, and then there is gout, so uric acid. The thing that's going to help with differentiating is actually either looking at the synovial fluid, so you can actually put a needle, remove some fluid, and looking at it. Or if the patient doesn't have any more fluid and it's actually taken care of, but you just want to prevent the next one, you can actually just look at other things that are making you think of this. So if the patient has had urinary, like a urinary stone, okay, a kidney stone, you can actually ask them, did they pass it? Did they analyze it? Was that radio opaque? So could you see the stone on X-ray, or did you not see it on X-ray? Why? Because if it's calcium deposit, you're going to see the kidney stone. If it's uric acid deposit, and so more like gout, you're not going to see stone. So by itself, if there is kidney stone and you can see it, you know that it's calcium deposit. So it's more like pseudo-gout. If it's not seen on X-ray, then it's most likely a kidney stone that's radiotransparent, not radio-opaque, and that's more for gout. Okay, so uric acid. That's like a real trick. That's kind of cool because both pseudo-gout and gout can look really similar. Okay, and then you're going to look at X-rays, and the X-rays can also give you some clues about, is this more looking like gout? Is it more looking like pseudo-gout? You can actually see chondrocalcinosis, which is calcium deposit in pseudo-gout. Okay, so then you treat the underlying cause. Do you have gout? Do you have pseudo-gout? Okay, and you treat the reason for pseudo-gout. So there are a couple of reasons sometimes that we can find, and there's a couple of reasons, for gout, you can actually decrease the uric acid, and that's actually I've done lives about that, so you can actually look at this. This is a whole topic by itself. Okay, so that's a crystal arthropathy. Now, We're going to go a little younger, a patient that has back pain, so inflammatory back pain. So inflammatory because it's pain that's worse in the morning, associated with morning stiffness. So they feel like they have to like open their back, and it takes more than 30 minutes. It takes usually 1 hour, 2 hours. And that's associated, that's improved with exercise. Okay, that's inflammatory back pain. That's worse in the morning, associated with exercise. Improve with exercise. And they're young, and at 20, at 30, even at like early 40s, you should not have back pain. There's no reason for it. And so, unless you have had an accident, there's no reason for back pain. And so, if you do develop this inflammatory back pain, we have to think of ankylosing spondylitis. And so that, that's actually pretty easy to make a diagnosis of ankylosing spondylitis. So we do blood work, we do x-rays, we do MRI of the sacroiliac, and that, gives us a clue. Okay. So that's an inflammatory back pain. Okay. Now we're going to go into inflammatory arthritis. This time that's symmetric. So this time, let's put that same woman, for not a different woman, like 45-year-old woman that develop joint pain that's symmetric of her wrist, of her the first, like the knuckles, of our knuckles, but only the first two rows, so what we call MCPs and PIPs. Maybe also has a joint pain of her feet. Okay. And she may have carpal tunnel syndrome symptoms. So when you feel like the first 3 fingers are numb or painful, send electricity. Okay. And so that's that. And then you like the fact that it's symmetric makes you think of rheumatoid arthritis. Sorry, I paused. I paused for the suspense effect. Now, also, I'm hoping some fellows are listening, and it's this kind of a fun thing to like try to think about it. Like, what can this be? All right. So yeah, rheumatoid arthritis, because it's symmetric, because it affects the MCP, the PIPs, the wrist, the feet, the MTPs. That can be rheumatoid arthritis. So of course, you're gonna rule out other reason, and of course, you're gonna also like rule it in. Does it have seropositivity? So is it positive rheumatoid factor, positive CCP? Okay, so that's inflammatory arthritis that's symmetric. Now, if it is an asymmetric arthritis, so it's inflammatory, but this time it's involving just the right hand and then the left foot. Maybe it's involving, the insertion of the tendons to the bone or the ligaments to the bone. Like you have to think of psoriatic arthritis. Okay, that's a good one. And you don't actually have to have psoriasis to have psoriatic arthritis. Okay, that's an important one. But if you have a family history of psoriasis, or if you have had psoriasis yourself at one point, that is more in favor of psoriatic arthritis. Okay, so there are actually inflammatory arthritis due to infection. So Lyme, also STDs, STIs, so sexual transmitted infection, can also cause inflammatory arthritis. And then if you have parvovirus, you can have inflammatory arthritis that actually presents a lot like rheumatoid arthritis. And in fact, it can lead to rheumatoid arthritis. So those are just some, common causes. Those are, I haven't talked about the paraneoplastic arthritis. So it's when you have, it's super rare, but when you have a cancer that's causing arthritis. I haven't talked about menopausal arthritis, postmenopausal arthritis. I haven't talked about sarcoidosis arthritis. Or I even haven't talked about the lupus arthritis. So there is so many other causes of arthritis, but really, I think if you're not a rheumatologist, what you want to really think about is this inflammatory, worse in the morning, associated with morning stiffness, improve with exercise? And is there swelling joint, right? Or is it mechanical, worse at the end of the day, no significant morning stiffness? That's, if you start there, you're already like doing a huge, like you're already knowing more than most people, and you also can reassure yourself. If it's mechanical, it's probably okay. All right. But yeah, so it's been long already. It's longer than I would like those lives to be, because I think 10 minutes is as much as anyone can really do rheumatology if you're not a rheumatologist. But that said, maybe you do want to become a rheumatologist, and that's great. If you're looking for a rheumatologist, I have some really exciting news. So I'm opening in Boulder. So Denver, I love Denver. I'm definitely a Denverite. And we have a location south, I'm showing north and south of Denver. And then because I've had so many wonderful patients from Boulder, and I've had patients from Boulder asking me to open in Boulder, I've decided to open in Boulder. So if you are in Boulder now, you have another rheumatologist in Boulder, and I'm just really, really excited to offer my services to the community. It's really a pleasure. So hopefully you live in Boulder, or you know someone that's in Boulder, and don't hesitate to let them know if they have a rheumatologic need, or if they know someone that has a rheumatologic need, that I am seeing patients in Boulder, and it's going to be actually a really exciting area. It's at the City Club, so the Highlands City Club in Boulder. It's absolutely gorgeous. The people who are there are amazing, and I'm really, really, really excited about this. Okay. So I will see you next week. Until then, have a wonderful week. It's always a pleasure. Take care. Bye-bye.